Question 61. Which of the following is the most likely explanation for her symptoms? GI, 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 GI. Okay, so it's a GI question. I know a lot of these questions have been like that. They're usually not that easy. That strategy of like starting with the last sentence and then looking at the answer choices doesn't work that frequently, but for these types of questions, it does. A 41-year-old woman presents with chronic diarrhea, bloating, and abdominal discomfort. She reports that her symptoms have gradually worsened over the past year. The diarrhea is non-bloody, very important, and occurs 3 to 5 times daily, sometimes associated with floating greasy stools. She notes unintentional weight loss and increasing fatigue. Her diet is varied and includes dairy products, grains, fruits, and vegetables. 3 months ago, she returned from a vacation to Puerto Rico. That's important. Okay, 3 months ago, vacation to Puerto Rico. She denies recent antibiotic use, surgeries, or new meds. Physical exam reveals mild pallor but no rash, oral ulcers, or lymphadenopathy. Here are some sweet labs. Hemoglobin is low, so she's anemic. She is microcytic, and she has some inflammation going on with ESR. Stool fat is increased. We already knew that from the floating greasy stools. So let's go through here. Functional irritable bowel syndrome, or in other words, irritable bowel syndrome, IBS. IBS is classically characterized by either constipation, diarrhea, or both, and usually pain associated with stools that is resolved after defecating. The way I remember IBS is that it's just essentially a neurologic condition for the gut. Very common in people with anxiety, and so it can be flared up by anxiety. New situations, uncomfortable situations can cause IBS flares. That is not what we have going on here at all. It seems to be 3 to 5 times a day, which is awful with floating greasy stools. IBS is kind of like how they mentioned it here, functional. It doesn't have fat malabsorption. It's not going to cause anemia. It's just diarrhea, regular watery diarrhea. So this one is out. Tropical infectious villus atrophy. So like a tropical sprue. That one could make sense because of the travel history to Puerto Rico. However, we really need to always keep track of the timeline here. So she went to Puerto Rico 3 months ago. Does that line up with the onset of her symptoms, which have been gradually worsening over the past year? No, it doesn't. So that one's out. Primary lactase deficiency. Usually you notice that sooner in life if you're lactose intolerant, but again, it's just gas, bloating, diarrhea after dairy. She does have dairy in her diet, but it's not going to explain floating greasy stools, right? The malabsorption. So that one's out as well. Again, it's really just diarrhea after dairy exclusively. SIBO, small intestinal bacterial overgrowth. That could look like this. You definitely can get a malabsorption. You can have multiple stools a day, non-bloody for a long time. Along with that malabsorption, you can definitely get anemia. You could probably get elevated ESR and fat malabsorption for sure. SIBO is pretty well known in questions to cause ADEC deficiency. These are your fat soluble vitamins. However, microcytic anemia, that would be from an iron deficiency, not necessarily a fat soluble vitamin. You can get an anemia, but probably not microcytic. It's usually a B12 deficiency that arises with SIBO. But, let's just not rule out just yet. Let's hit everything. We'll come back to it. Because honestly, overall, it's a pretty good answer choice. Autoimmune mediated villus atrophy. So this is referring to probably celiac disease, right? We didn't have any of the iconic antibodies, autoantibodies listed here, but we do have the fat malabsorption. We've got some anemia. Iron deficiency anemia is very common in celiac. So this one looks very similar to SIBO for sure. What's the difference? Well, we should talk about SIBO. SIBO is most commonly due to gut dysmotility. So if the GI tract is not moving the way it's supposed to, think diabetic gastroparesis or strictures, maybe even surgical adhesions, anything that might get in the way, slow down the rate of food moving through the GI tract, that could be SIBO because that will give time for the bacteria to colonize that food and colonize your gut. And she doesn't have any history of GI surgery or diabetes, nothing that could potentially slow down peristalsis. So whenever you get a question like this, I think with that alone, we can more definitively say celiac is probably it. But when you do get a question when you're not quite sure, maybe it could go one way or the other, I would go with the one that's most common, and that is definitely going to be celiac disease. But again, SIBO, think GI dysmotility. So the correct answer here is celiac. They can present very similar, but really one of a big clue is the iron deficiency that happens. It tends to happen pretty early on in celiac disease and not so much in SIBO. And again, the other hint against SIBO is the lack of risk factors for GI dysmotility.